discussion about wounds.
Thanks everybody for coming today. So as Dr. Barazowski said, my name is Bailey Smith. I'm one of the interns this year. Unfortunately, my presentation won't be quite as hilarious as Dr. Malik's, but I do have some gruesome pictures, so I apologize to anybody who's a little bit squeamish. Please focus on the words. So this talk is not meant to be taken as a replacement for a veterinary consultation, but more as a means to kind of fill you in on some of our thoughts and processes and make you more educated for caring for your horse at home and assessing the need for veterinarian intervention. So let's say your trusty steed came in from the pasture today with a gaping wound on his leg. I'd first like to go through what you can do for your horse at that point. So number one, stay calm and stay safe. Be sure to catch, calm, and settle your horse. He's often just as freaked out about the wound as you are, and particularly if it just happened, he may be in a great deal of pain. Horses in pain are rarely smart or sensible, so try to keep everyone safe by moving to a quiet area. Once everyone is settled, assess the situation. Try to determine if the wound is severe or minor, whether it looks old or fresh. You may have a great deal of experience in managing wounds, and if you have the materials and it's not too bad of a wound, you may choose to address it yourself. But if in doubt, have the vet out. If anything, they can just discuss the management with you, provide you with the materials that you'll need, and if the wound's up being more substantial than you thought, you'll be happy that you dealt with it right away. In terms of assessing severity, you may consider the size of a wound. However, don't overlook puncture wounds like this one. It's certainly not all about size. Puncture wounds can be deadly as they often go deeper than we realize and often involve sensitive structures. And many times there's a great deal of bacteria that has been trapped within the wound, and that provides optimal conditions for the development of infection. So not all puncture wounds are devastating, but just don't underestimate them. The wound may have a flap. Flaps can often be tacked in place and act kind of as a band-aid. And if they are addressed right away, they can be saved. So with all flaps, I would say, don't delay. The location of the wound is probably the most significant part in determining the severity. Knowing a little bit of anatomy can help you relay the information to your veterinarian and help you determine the severity yourself. So even a very superficial wound over a joint, such as the hock as seen in this picture, could still be very significant. Embedded objects might be an obvious one, but especially if there's a stick of this size, there are often wounds that you do not want to deal with on your own. If anything is left behind, the wound is much less likely to heal, and if it's stemming off the flow of blood, you really don't want to pull it out unless you have someone there to manage the aftermath. So I would recommend any wound with anything in it should be seen by a vet. It's important to gather as much information as possible to relay to your veterinarian. Having a discussion with your vet may help you decide if the wound is something that they need to see. We often get these calls, and the more information you have, the better we can help you assess things. So some relevant information includes the cause of the wound, the size and location, whether it's bleeding, if a joint, bone, or tendon seems to be obviously involved, if there's anything in the wound, if the horse is lame, if there are any signs of infection, and if there is an eye involved. I'll tell you right now, if there's an eye involved, you're going to want a vet to look at it. So just a note on blood. Horses can lose a lot of blood, and even a little bit of it is going to look like a lot. So fresh lacerations will often ooze or drip blood from veins and capillaries, whereas arteries will spurt or spray blood. In these cases, it's important to keep the horse as quiet as possible and apply a pressure bandage while you wait for the vet. There aren't many wounds that can be stopped with a bandage, or at least slowed for long enough for the vet to get there, including this one. So here's how to apply a pressure bandage in the case of a wound that's bleeding a great deal. Sterile gauze wrapped tightly with cotton and vet wrap is ideal, and it's always good to have these materials on hand. However, in the event that you don't have them, towels and duct tape or even white tape will suffice as a bandage. For body wounds that cannot be bandaged, simply applying pressure with a towel is helpful. If the bandage becomes soaked through with blood, do not remove it, simply add another layer on top, as this will help the clot formation and the blood to stop. So when it comes to fresh wounds, such as this one, you may briefly and gently clean away any major contamination using clean water. It's important not to flush the wound for too long though, because you do want that clot to form. In older wounds that are crusty or dirty, it may be best to leave for the veterinarian to clean. Keep the horse in a clean and dry area, and if possible, place a bandage or a staple wrap over the wound until the veterinarian arrives. While waiting for your vet, there are a number of things the horse owner should not do. So placing fingers in the wound can contaminate it, so keep your fingers out and keep the wound clean. Do not flush a puncture wound as you don't know where it goes. Do not apply any ointments, creams, or wound preparations while waiting for the vet, as this may make the wound more difficult to clean and assess, and ointments often attract more debris to the area. As well, the product may not be safe for any exposed structures. Do not remove foreign objects, as I mentioned, if possible. This may include a stick somewhere or a nail in the foot. As long as leaving it in place isn't going to push the object further into the horse, it really helps the veterinarian to identify exactly where the object went. If you absolutely have to remove the nail from the foot, for example, be sure to pay very close attention to where it's going and how deep it went. So now that we have a brief idea of what's going on, we're going to talk about some factors involved in wounds and that determine how well they heal. By knowing these factors, we can support the wound by eliminating issues and make decisions to best optimize healing. So, number one, wounds need to be free of contamination, or at least minimally contaminated. Skin edges that are touching speed up the healing process and reduce the risks, which is why we try to close a lot of wounds. Conditions for skin development include a smooth, healthy bed of granulation tissue, as seen in this above picture, that does not protrude above the level of the skin. Skin grows out, it can't grow up. Moist wound environment will speed healing and minimize scar tissue formation, and immobilization of the area will aid in proper tissue formation, reducing the risk of proud flesh development. Wounds located over synovial structures must be examined closely to rule out their involvement. Synovial structure involvement is truly the difference between a $300 vet bill and a $5,000 vet bill, and whether or not you're going to have a sound horse. Synovial structures aren't just joints, though. There are a number of bursae and tendon structures and sheaths involved. We certainly don't expect you to know all of these structures, so if in doubt, especially with the lower limb, have the vet out. I'm sorry for my crude paint skills. There are a number of things that negatively impact a wound healing. Contamination leads to infection if not addressed, and infection is the most important reason for delayed wound healing. The greater the contamination, the greater the risk for infection. Dirty wounds will have 25 times a greater degree or rate of infection than do clean wounds. There are many ways we can minimize the degree of contamination that we will cover briefly today. The cause of the wound does have implications on how we treat the horse as well, and the likelihood of the wound becoming infected. For example, sharp lacerations are more resistant to infection, whereas shear wounds from horse bites or sticks are more prone to infection because of the greater soft tissue damage and blood supply altered. For the same reasons, injuries resulting from entanglement in a fence, or what we call crush injuries, are 100 times more prone to infection than sharp injuries are. So those horse versus barbed wire fence incidents that we may see look horribly gruesome, but they usually turn out a lot better than the horse versus smooth wire. As well, puncture wounds, as I mentioned, are much more likely to become infected rather than an open draining wound that is much bigger in size. Location also determines blood supply, which is a big determinant of wound healing. The more blood supply, the better and faster wounds will heal typically. As a result, wounds on the head will heal faster than those on the leg, and flaps that have a good blood supply are much more likely to heal than those without. Exposed bone has a higher risk of infection because bone has a poor blood supply. As well, wounds on the limb are harder to heal They have slower skin development and are much more likely to develop proud flesh. Finally, wounds near the rectum or on the ground are much more likely to be contaminated due to their proximity of contaminants. Wounds subjected to excessive movement, such as those located over highly movable joints or the back of tendons, are slow to heal and usually form more scar tissue. Stabilizing the wound using special suturing techniques, bandages, splints, and casts can often reduce the effects of movement. Some wounds cannot be completely closed due to the excess tension required to bring the wound edges in contact, such as those on the shoulder. So this tension may also result in prolonged wound healing. As I mentioned earlier, addressing flaps early on can be advantageous. Stabilizing the flap into a somewhat normal position will prevent the flap retraction, covering sensitive tissue, and increase the chance of a reattachment. For example, this is a large body flap that this horse sustained, and due to the surface area and orientation of the flap, it was unlikely that it would all survive. However, by attaching the flap, we were able to save some of the skin and provide a better environment for the healing tissues underneath. This is a picture of the flap with a great deal of it dying. This tissue will need to be trimmed in the future, but then by then the underlying tissue will have had a better chance to survive. Now that we know a little bit more about what determines good and bad healing, it will be easier to understand what the vets do in managing wounds. Often the vet will stabilize the horse and stop any bleeding, as well as perform a routine physical exam to assess the horse's overall condition. Next, the vet will clean around the wound to achieve better visualization and assess the wound. Depending on the location of the wound, there may be need for further investigation. We may need to determine if a joint is involved in a wound by injecting sterile fluid in to see if it comes out the wound. Assessment may also require radiographs with or without probe placement or ingested contrast, such as seen in these pictures, to determine if a joint is involved, or to determine where an embedded object goes. Other times we require ultrasound to determine soft tissue damage. The wound will be cleaned and debrided of dead tissue, and the potential to close the wound will be considered. One thing that people often forget about is the need for an update tetanus vaccine. If there is a chance that the horse could have cut himself on metal, or if there is a puncture wound, vaccination for tetanus within the last 6 months is recommended. If the history is unknown, it's typically safer to provide the vaccine than to take the risk. Antibiotics are often recommended for extensive wounds to prevent infection, or they may be used later if the wound becomes infected. We try to use antibiotics as little as possible, but when they are needed, it's important that they're used properly and completely. Typically, a minimum course of 3 to 5 days is recommended with contaminated wounds without signs of infection. However, longer courses up to multiple months may be necessary for wounds with established infections or bone involvement. Anti-inflammatories like bute may be needed to manage a horse's comfort and mitigate swelling, as Matt has discussed. However, there are negative side effects to the use of any anti-inflammatory, so it's important to consult your vet for duration and timing recommendations. So vets will clip the hair around the wound and fill the wound with sterile lubricant to avoid having small hairs trapped in the wound to contaminate it. The next step is cleaning the wound. An ideal wound cleansing agent combines antiseptic and cleansing properties while minimizing the damage it causes to cells. Wound beds gently cleansed with antiseptic and followed with a copious lavage will help remove foreign material, decrease bacterial load, and minimize the harm to the tissue, while ridding the wound of the dead tissue. Povidone iodine and chlorhexidine are the 2 antiseptics most commonly used. Povidone iodine is also known as betadine. It's a good choice, but it does kill healthy cells along with the bad ones, so it's important to not overdo the cleaning. It should be used in solution, the color of a weak tea, for maximal effectivity and minimal harm. Too concentrated of a solution can actually favor the development of infection by deterring the body's defense cells. Chlorhexidine, or hibitane, is a good choice, but it cannot be used around the eyes, and if used excessively, it can also slow healing by killing healthy cells. It has residual effect that iodine does not, and it has better activity in the presence of blood or pus. The wound bed can be gently cleansed and scrubbed, but wounds scrubbed with coarse sponges were shown to be significantly more susceptible to infection, so just be careful how hard you're scrubbing. Rinsing is just as important as the cleansing, as it removes the debris and bacteria and can stimulate circulation to an area. If the antiseptic is not lavaged adequately, it will delay wound healing. Studies have shown that there is an ideal pressure for lavage. Too much pressure can actually push bacteria further into the wound, but you do need enough pressure to effectively dislodge debris. This has been shown to be the equivalent of using a larger size syringe with an 18 or 19 gauge needle on it. Tap water can be used to initially clean the wound, but for optimal cleaning, wounds should be flushed with a sterile saline-like solution to minimize edema and contamination. Debridement is the removal of dead or unhealthy tissue from a wound bed. Sometimes debriding the wound once at the time of presentation is sufficient, but other times you'll need serial debridements later in the healing process. Initially, debridement is essential to reduce the bacterial contamination potential, but later it's used to reduce granulation tissue, such as seen in this picture, to allow that the smooth surface for the skin to migrate over. Granulation tissue is composed of small blood vessels and cells called fibroblasts, but it doesn't create or contain any nerves, which is what allows us to cut away the excess tissue without the horse being bothered too much by it. In the end, you'll get something like this, which looks like a horror film, but it's actually a much healthier surface than the previous image. Many factors must be taken into account to determine whether a wound should be closed or not. Closure can be considered if a wound is clean or minimally contaminated and there's still a good blood supply. Head wounds, flaps, and wounds of the upper body, as well as those caused by sharp objects, are more likely to be able to be closed right away. And we have much better luck with good closure and good healing if the wound has been closed in the first 24 hours. These wounds often have less contamination at this point, and the skin isn't shriveled up. However, when there's excessive motion, tension, and contamination or tissue loss, suturing might not be successful and could actually lead to increased costs of treatment and risk of complication. So we can get quite creative in these opportunities when our closures, sometimes to improve the chance of their success. In areas of tension, we'll use things like buttons or stents, as seen in this picture, which reduce the tension that's applied to one area. Many times with large flaps, we'll also use drains for a short time to allow drainage of fluids that would otherwise impede the healing of the tissues. So now we're going to cover some bandaging, the purpose of bandaging, layers of bandages, a little bit of how-to, and some tips that might help you at home. When discussing bandaging, we're going to stick to legs in the interest of time, and because that's what's most common. However, the same principles can be applied to any bandage on other structures. Bandages maintain that moist healing environment that we want, and they increase the local temperature, which actually increases the oxygen availability to the healing cells. As well, they encourage the formulation of granulation tissue in the early stages of wound healing. The bandage can provide that immobilizing effect that we desire, and compression bandages can also help minimize swelling and edema development. Finally, they obviously protect from the environmental cold and contamination. A proper leg bandage has 2 or more layers. If a wound is involved, a gauze, pads, or a sterile absorbent dressing will be required. And this is what we know of as the contact layer. Contact layers can be adherent or non-adherent, meaning they stick to the wound or they don't. Telfa is an example of a non-adherent material where the shiny side is coated so that it doesn't stick to the wound. On the other hand, gauze will absorb fluid and dry stuck to the wound. This can be useful because when you take the gauze off, you're actually removing the dead cells with it, but know that this is non-selective and that you're also removing the healthy healing cells. So as soon as there's new skin development, we want to use something like Telfa that isn't going to stick to the wound and take away all the healing that's already occurred. Regardless of the material, it's important when applying the contact layer that you avoid touching the side that will go against the wound, because you're then contaminating it and introducing that directly to the healing cells. Padding is essential for protecting limbs. Know that you cannot pull tight on any bandage if you don't have padding. So it is essential to distribute the pressure evenly around the limb and prevent blood flow from being restricted in any one area. It will also absorb any extra drainage from the wound. And generally, the longer a bandage is to remain in place, the more padding you're going to want. As well, you can increase the pressure of a bandage by adding more padding. Rolled cotton, sheet cotton, or leg quilts work well. They're lightweight and comfortable. The next layer of the bandage is the support layer. This includes rolled gauze, vet wrap, and light plast. To hold the contact layer in place, we'll use a white gauze. Padding is held in place by a brown gauze. Brown gauze doesn't stretch, which allows you to determine how much pressure you want to apply to the bandage. Vet wrap is used to cover the brown gauze, and it's protective and securing. However, it can be pulled too tight and cut off circulation. So the rule I use is to just pull the waffles out. So if you have enough tension, you can't see the squares in the vet wrap anymore, but you're not really reefing on it, then you're likely at a good tension. Finally, light plast is like an adhesive or glued on version of vet wrap. We use it to secure the top and bottom of the bandage to keep things from entering the bandage, as well as to keep the bandage in place. So here are some tips for bandaging. Number 1, apply with care. For whatever purpose you're bandaging, it's essential that you use the proper leg bandaging techniques. Applied incorrectly, bandages can not only fail to do their job, but they can also cause discomfort, restrict blood flow, and potentially damage tendons and other tissues. It's often said that it's better to leave a horse's legs unbandaged than to do it incorrectly. Fortunately, there is nothing too complicated about learning to do this. It simply takes the right materials and a bit of practice. Do your bandages in a clean area, such as the walk track or a clean aisle, because there's nothing worse than a beautiful bandage with a bunch of shavings stuck inside of it. That kind of bandage really negates the point of us bandaging in the first place. Bandages that are applied wet or to legs that are wet can pinch and irritate the skin, and then we result in the bandage sores and the white hairs that a lot of people see. If you're working on a hind leg, be sure to tie the tail up right away, as it will inevitably get in your way, and it also carries a lot of dirt and feces that can end up contaminating your wound. The bandage must be applied smoothly, evenly, and with the right amount of tension. I use a 1 to 2 finger rule to dictate the appropriate tension. So if I cannot fit 2 of my tiny fingers down the bandage, it's too tight. Too loose of bandages are equally as dangerous, as they may become entangled or endanger the horse. And you should overlap each preceding layer by 50%. Lastly, avoid ending your bandage over a joint. It'll help it stay tight and in place for longer. So we're going to quickly go through a couple of bandage examples. This one is the light bandage. It's more of a band-aid than anything. We'll use it after surgery sometimes, or if your wound has reached a point where it's pretty protected by the granulation tissue and you just want to keep it covered from the elements. First, you apply your contact layer of choice, whatever that one may be, and then wrap the light plate lightly over the contact layer to keep debris out and hold it in place. Remember, because this bandage doesn't have padding, you don't want to pull that tight. You just need to really lightly apply the tape. The next is a Robert Jones or a pressure bandage. We use a lot of these in hospitals and with wounds, as they're really good at minimizing swelling and dead space. To apply this bandage, you place your contact layer over the wound, wrap over top with the white cling roll that we use using light tension. Then you wrap the large white cotton roll centered over the wound. The more snugly you conform this roll to the leg, the easier it will be to compress the bandage. Then you wrap the brown gauze layer over top of the white cotton. As I mentioned, this is the tension layer, so you can apply quite a bit of pressure. Leave approximately 1 to 2 inches of white cotton at the top and bottom of the bandage, and apply your vet wrap directly over the brown gauze with moderate tension, so pulling those waffles out. Place 1 to 2 wraps of light plast over the top and bottom, just to keep the bandage in place and keep debris out. Applying a hock or knee bandage is not without its challenges. Because of the shape and motion of the joints, it requires special techniques to make these bandages safe and secure and effective. Bandaging wounds by the knee or hock requires what we call a stacking bandage. This keeps the bandage from sliding down the leg, as well as keeping the swelling out of the lower limb. For larger wounds, the lower wrap may also be a disposable bandage, just like you placed over the wound, and that's seen on the bandage on the right. Bony prominences will require holes to be made in the supporting layer down to the cotton, and this is to avoid pressure on these areas. It's important with knee bandages, as there's an accessory carpal bone on the back of the knee, and on the hock bandage involving the tendons at the back at the top of the hock. If you're using a non-disposable bandage, or if taking a scalpel blade to the fabric on your horse's leg makes you a little nervous, there is an alternative. This is called a figure-of-8 bandage, and it's used to strategically avoid the back of the calcaneus on the hock, but it can be used to avoid the accessory carpal bone on the knee as well. The lower limb bandages should incorporate the heels to prevent the bandage from riding up the leg, and to apply even pressure over the limb, avoiding too much stress being placed on the coronet band. You may be familiar with duct tape weaves from doing abscess bandages. They work really well to cover any bandage really low on the foot, and they can be made on any flat surface, including the countertop or the tops of your knees. This is done by applying duct tape in two layers in two directions perpendicular to each other. You then cut lines into the center from the corners, leaving a hoof-sized circle in the middle. The duct tape can then be applied to the foot and each folded up just like a diaper. It's wise to seal the bottom with another layer of duct tape just to keep things from sneaking in. And never apply duct tape to the skin, as it can create a tourniquet effect. It should always be used over a bandage. So now you and your horse are back at home, and here are some tips and treatments for ongoing care. Number 1, keep the wound clean. This includes bandaging and wearing gloves. There are a number of nasty bacteria on your hand that you don't want to share with your horse's wound, and this is particularly important if there are exposed structures. The vet will recommend a frequency for bandage changes, but most often we recommend every other day unless the bandage becomes wet, dirty, or falls down. If you find the wound is producing so much that the bandage is becoming wet from the inside, you may want to change it more frequently to prevent the bacteria from traveling from the outside to the inside via the moisture. At other times, when the purpose of the bandage is just simple protection from the elements, and the wound is no longer discharging, you may be able to change the bandage less often, even like 4 to 5 days. As always, before wrapping, take those few minutes to examine the legs for any signs of heat, swelling, or irritation. And clean the wound only when necessary. This is especially true with wounds containing sutures, because sutures are made to dissolve, and getting them wet often speeds up their breakdown. We do encourage cleaning around the wound to prevent discharge from irritating the leg. So ointments can be applied as part of a bandage or without the use of a bandage to prevent the wound from drying out. Some ointments also have antibiotic properties, and there are many wound ointments out there, so I'm only going to focus on a few. At Moore, we use a lot of dermagel for our minor abrasions, wounds, and bandage sores. It's really good at keeping the wound environment moist. Hibitane cream is a good topical antibacterial for wounds. Honey can have antimicrobial effects and act as a drying agent. It also contains antioxidants to protect the tissue and promote repair. Similarly, sugar is used in the dressing sometimes, particularly for the foot in abscesses, as in very high concentrations it's antibacterial and can enhance the healing of a wound and draw fluid out. Silver sulfadiazine is an excellent product, although it is expensive and sometimes hard to come by, but it's great for large superficial wounds or burns. Bandaging wounds of the body is difficult and often impossible. So sometimes we'll recommend hydrotherapy or cold hosing to cleanse the wound, increase circulation, and stimulate healing. However, too much cold hosing can actually be a bad thing. Tissues can become waterlogged, which result in the cells swelling and dying. And too much pressure can actually push bacteria deeper into the wound. As a result, we recommend cold hosing with a gentle stream for about 10 to 20 minutes a couple times a day. Remember, this is not advisable if a joint or other structures are involved in the wound or if it's really deep, as you end up washing dirt from the body into the wound. So, it's important to know also about what can go wrong with bandaging wounds so you can recognize them when they happen and avoid them. Bandage sores are the result of rubbing and pressure. They can have major or minor complications depending on the location and severity. They are especially prominent with top bandages in the calcaneal tendon location and foot bandages on the coronet band and heel balls. If you encounter a bandage sore, you may apply Dermagel and bandage those areas themselves like their own wound. Other times, reevaluate your bandage to make sure there's no wrinkles causing these pressure points and that it's appropriately tight. If possible, stop bandaging, and when in doubt, seek veterinary advice. Granulation tissue forms in wounds. It's like the healing filler, and it helps the open wound resist infection, as well as providing that surface for the skin to crawl across. Granulation tissue is very important, and it's a necessary part in the wound healing. However, there can be problems when the horse develops too much granulation tissue, and that's what we know of as crowd flesh. Crowd flesh is not conducive to wound healing, as it prevents those skin cells from traveling over the wound, and it can be very difficult to manage, becoming quite large. Crowd flesh usually occurs within wounds of the lower leg of the horse. We think due to the excessive movement that those tissues often experience, contamination is higher, and they often have higher poor blood supplies. Therefore, bandaging is very important in the prevention of crowd flesh, and the treatment usually involves debridement of the tissues. Signs of infection will include heat and pain, as well as swelling in the area, such as seen in this picture, discharge, smell, or reddened tissues, fever, depression, or loss of appetite. If the infection is suspected, you should contact your vet right away, as it can have dire consequences. Finally, bone sequestrums are the result of bone involvement in the wound, from loss of blood supply to the overlying tissues of the bone. The signs of the sequestrum will include chronic, non-healing wounds, pain when the area is palpated, mild lamenesses, and the presence of a draining tract. Bone sequestrums do require veterinary involvement. So I hope you took away something from this presentation. I know it's a little lot, but I hope you feel a little more educated and prepared to face your horse's wounds, because they're inevitable, it seems. Some points I wanted to emphasize are wounds that require immediate attention, such as those involving a lot of tissue, bone, or tendons, anything near or over a joint, anything with a penetrating foreign body, and those that are spurting blood or involve a lot of blood. Don't forget, don't underestimate those puncture wounds. Bandage carefully, and be aware of the potential complications that can occur, so that you can identify them and avoid them. And with that, I'll take any questions that we have time for.